Have you or a loved one suffered from a traumatic experience? Are you feeling detached as if you're outside of your own body? Are you feeling like you have to escape reality in ways that are involuntary or unhealthy that are making everyday life harder? Do you have extreme loss of memory? Take a step and seek diagnosis.
Some of the 5 major symptoms of dissociative disorder are amnesia, which is memory problems involving difficulty recalling personal information. The second one is depersonalization, which is the sense of detachment or disconnection from oneself. There's also derealization, which is a sense of disconnection from familiar people or from your surroundings. There's also identity confusion, which is an inner self struggle about your sense of self or identity. And there's also identity altercation, which is where you act like a different person.
If you're feeling any symptoms for any of these 5, don't worry, because there are treatments for one dissociative identity disorder. There's a treatment that you can, it's talk therapy with others or one-on-one. And there's a treatment that's eye movement desensitization and reprocessing, which it will help integrate the 2 hemispheres of the brain to help recall events.
Dissociative identity disorder is one of the more well-known mental disorders that are experienced by people around the world. Research is currently being conducted to thoroughly understand this personality disorder. However, it is still relatively vague in the mind of researchers. Approximately 1% of the general population has been diagnosed with dissociative personality disorder. Again, if you are having suicidal thoughts and tendencies, anxiety attacks, severe phobias, abuse of alcohol and/or drugs, hallucinations, whether visual or auditory, mood swings, severe depression, insomnia like sleepwalking and/or night terrors, out-of-body experiences, and self-sabotage or outward and self-inflicted violence,
take a step and seek diagnosis.